Have you ever felt like your heart racing or pounding? That is what a palpitation is, right? Did you know that that's actually one of the most common symptoms in perimenopause and menopause? And it can be super scary, right? And it can be unsettling and very scary experience. But it is actually something that happens normally. And this has to do with the fact that when we lose estrogen normally what it does is it helps regulate the autonomic nervous system and the blood vessels. So when they fluctuate, heart rate variability can increase, making you feel the symptom of fluttering or palpitations. Now, we also know that stress, hot flashes, and inadequate sleep can actually make palpitations worse. However, most menopause related palpitations are harmless, but they can be very alarming. Now, here's the deal: if you are uncomfortable, you need to get checked, right? Don't just assume that it's menopause. It's always important to rule out heart disease. The good news is, if it is related to perimenopause, there are so many ways we can help with it. In my practice, we think about the 4M pillar approach: meals, movement, mind, and meds. And lots of things can be done. We can limit caffeine, limit alcohol. Um, Relaxation reduces these adrenaline surges that happen. And for as far as medication, FDA approved hormone therapy in the form of estrogen and progesterone, specifically estrogen, can actually help regulate this, as the palpitations tend to occur with the variability or the roller coaster of hormone levels. So, giving a steady state actually helps improve that. Of course, this should be done along with stress reduction and a lot of things that we want to do to protect your heart. So remember this: menopause and palpitations doesn't mean your heart is failing. It often means your body is adapting to all these hormonal changes. And remember, like I always say, this is literally biological. Okay. It's not a sign that we are weak. It's not a sign of something markedly wrong, although you do have to get checked with your provider. Um, it can be part of the changes of this life transition. And if you are in Pennsylvania, I would love to help you finally stabilize this. Okay. I actually have so many patients that actually have these as one of their mild symptoms. But definitely they report improvement of the palpitations when we initiate FDA approved hormone therapy. So I hope I could do that for you. So if you're in Pennsylvania, let's start with an initial consult that goes over your individual history and how hormone therapy can potentially help you out. And I'd love to help you. Again, board certified menopause society physician here, Dr. Trapman. See you next time.